Okay. All
All
right,
right.
everybody. I would like to welcome everyone today to today's webinar. My name is Michael Rubenstein with Franchise Benefit Solutions. We will get going into our presentation here shortly. Just a couple quick things presentation-wise as we get going. As you just heard, the presentation is being recorded. This will be sent out at a later date, early next week. If you do have questions throughout this presentation, there is a Q&A button at the bottom of your screen. We will be getting to all questions at the conclusion of our presentation, but feel free to enter them in as we go throughout the presentation. Everyone will be muted throughout the course of this, so if you do have anything going on in the background, that is more than okay. At this time, we have Michaela and Megan from Best Life Brands, and Michaela had a few things she wanted to touch on before we go ahead and get started here.
Yes. Thank you everyone for joining us today. We know that this was scheduled kind of last minute, so we appreciate you guys making the time to hop on and learn about franchise benefit solutions as open enrollment is coming up. Offering any type of benefits to your employees goes a long way with recruiting and retaining top talent. So it's definitely something that we encourage you all to look into. They're going to go through different options for you guys that might make the most sense for your business. So once again, we appreciate you being here for this webinar. For anyone who hasn't met me yet, I know all four brands are present. I'm Michaela Pearson. My counterpart is Megan Beaudry. She's on the call as well. We're both in HR programs, and we support all of you guys with recruitment, retention, and engagement initiatives. So welcome to, and it's nice to have all of you guys here. I'll pass it back over to, actually just kidding. Before I do that, I want to give one reminder to all of you guys. You've all received links to surveys from Megan or I. It should have come from your FBC or RPC for those with Care Patrol. If you haven't completed that, we ask you to please do so as soon as possible, as this is your opportunity to give us any sort of feedback on any of the tools and trainings we've offered throughout the year, even any of the vendor relationships that we've presented to you all. So please take a moment to fill that out and let us know what you'd like to see for 2023, as well as anything you'd like expanded on. Those surveys have already been sent out, and we've sent out many reminders. So thank you to anyone who's already completed them. And if you have not, please take the time to do so. Okay, now I will pass it over to Bernard.
Thank you, Michaela. Thank you, Michael. Good afternoon, everyone. Over the next 30 minutes, we are going to be discussing facts about franchise benefit solutions, challenges facing franchisees, our program advantages, our 2023 carrier changes, our 2023 product portfolio, solutions to help you hire and retain employees, key provisions of the Affordable Care Act and how it may affect you, 2023 open enrollment, and like Michael mentioned at the beginning here, we'll open it up for questions and comments. So let's begin with facts about franchise benefit solutions. With over 35 years of experience specializing in the customized benefit programs to the franchise community, our firm provides exclusive national and local plan designs to businesses across the United States. Over the years, we've had the privilege of partnering with Valpak Grocery Outlet, The Joint Chiropractic, Ben Franklin Plumbing, 1 Hour Heating, and Jenny Craig, amongst others. In recent years, franchisees have expressed an interest in offering alternative benefit plans to help recruit and retain employees. So why do clients choose us? We know what it means to be a franchisee. It's in the name of our company. We're experts in healthcare solutions. We offer exclusive franchise programs. We have the knowledge of the Affordable Care Act and how it may affect you. We offer outstanding service, and most of all, franchisees trust us. So what are some of the challenges that are facing franchisees today, such as yourself? And as Michaela mentioned, hiring and retaining employees is the #1 challenge. Offering affordable health plan options is #2. We've noticed over this last several years, and you probably have also, with the increase of healthcare plans. New franchisees with limited benefits knowledge. When we first began with Best Life brands, many of the franchisees have no knowledge or little knowledge of what it's like to set up a benefits program. And finally, for those franchisees that have over 50 full-time equivalent employees, ACA compliance issues for franchisees, again, with over 50 full-time employees. A few highlights of the Best Life Brands franchisee benefit program include exclusive plans to help you attract and retain employees, affordable group plans and rates, all with guaranteed acceptance and no wait-in periods. We offer medical, dental, vision, life insurance, accident, critical illness, hospital indemnity, telemedicine, prescription drugs, and short-term disability. Plans and rates for our voluntary programs are the same no matter where your business is located. If your business is in Washington, California, Florida, or Missouri, the plans and rates are the same. No participation or contribution requirements. Plans can be employer paid, standalone, voluntary, or packaged together through payroll deduction. If you have 25 employees and only one employee wants to enroll, we'll enroll that one employee. Rather than you submit payment to different insurers, Franchise Benefit Solutions will send you a consolidated monthly invoice that you simply pay online or mail us a check. Looking ahead to 2023, our carrier changes. For those of you that are current clients, if you offer the current MEC plans through Lucent Health, we'll be moving to SBMA. Our dental, group life, and voluntary life through Reliance Standard will be moving to MetLife. For those of you that have vision through VSP or IMED, we will no longer be offering IMED. We're going to move to VSP. Hospital indemnity, accident, and critical illness currently through AFLAC will be moved to MetLife. What we were looking at is we started probably around June, July, start sending out proposal requests, looking at different national carriers on offering benefits for our block of franchise business, and MetLife came back with the best plan, so we decided to make the move beginning for 2023. Our health plan options. Our platform offers 3 health plan options: individual and family, comprehensive group health plans, and voluntary group health plans. As you can see on the screen, our individual and family, we offer a online quoting portal that I'll go over in a minute here, where you're able to go online, input your information, and view the providers from the lowest plan to the highest plan. Comprehensive group health plans, we offer national and local plan designs, ACA and non-ACA compliant plans. We require a minimum of 2 employees, and both ACA and non-ACA plans, the rates are based on the demographics of your group's employee census. Our voluntary group health plan, which is our most selected plans, our healthcare plan is an inexpensive alternative to high-cost medical plans. We're going to be offering a new MVP plan, which provides more comprehensive coverage, such as inpatient and outpatient hospitalization, and we require minimal employer contribution. Like I said, our individual and family health plan is through an online quoting portal, and you can see you can visit the bestlifehealthbenefits.com. There's a link under the individual tab that you could click that, and You'll be able to compare affordable health plans from different carriers, find out if you qualify for financial help through the marketplace, view benefits at a glance. You're able to view local providers and apply online or download an enrollment form. Once you reach the portal, step 1, you put in your zip code. Step 2, you'll have to put in your family or your personal information. Once you do that, then what will come up will be on the right hand of the screen, will be from the lowest plan to the highest plan. We just happen to run a local plan here in Michigan, and Blue Cross plans came up here. But again, it will allow you to see different carriers and select the plan that you feel is best for you. If you're considering a group option, we can help you make the right decision that best meets the healthcare needs of you, your business, and your employees. Comprehensive group health plans are based on the demographics of your company, along with your employee and dependent ages. We would need census information in order to provide you with a group plan. We offer ACA and non-ACA compliant plans. ACA compliant plans are community rated, while non-ACA plans are based on the demographics and medical history of your employees. Non-ACA plans can be about a 30% lower in cost than the ACA plans. So the ACA plans actually came out at the same time that the marketplace or the Obamacare. The non-ACA plans were plans that were prior to the Obamacare or the marketplace. The non-ACA requires a minimum of 5 employees, but from what I'm hearing, some of the carriers are actually reducing it down to 2 employees. The ACA, again, are community rated. They're based on the demographics and your employee census. Carriers will allow eligible employee waivers where the non-ACA will not. Plans are under the ACA compliant are guaranteed issue with no medical questions, whereas the non-ACA compliant group plans will require medical questions. The carrier can rate you or decline you, but we're also looking at, I've noticed on a few groups that been approved that we haven't really seen a rate or carrier declining. But from what I'm told is groups that have high claims cost may receive high rate increase. So we've seen rates as low as 30% rate reduction from ACA compliant. So if you're looking at wanting to look at a non-ACA, then reach out to us and we will have to send you a census information in order to obtain a quote. Our most popular option is our low-cost voluntary group health plans, which is similar to an association health plan. Our voluntary MEC plans are all about easy access to the healthcare system, otherwise unattainable for many employees. The basic MEC plan covers preventative services only, while the MEC Plus and Advantage plans covers preventative services, primary care, and specialist visit, along with urgent care, lab and x-ray services, and generic prescription drugs. The Advantage plan combines the MEC Plus and value-added benefits through MetLife, which is a benefit payout to the member. So I want to make sure everyone understands how the plans work. The basic MEC covers physicals only. So it covers 100% of anything that has to do with a physical. It could be the exam, any type of testing, colonoscopies, mammograms, anything that is any type of service that is coded as a wellness exam would be covered 100%. MEC Plus also covers preventative services 100%, Primary care visits, a $15 copay. Specialist visit, also 15 copay. Urgent care, lab and x-rays, a $50 copay, and generic prescription drugs, a $15 copay. The plans, the MEC plans do not cover inpatient, outpatient, or emergency services, but we also offer a hospital indemnity plan that most employers will include as a package with these MEC plans. Now, the Advantage plan also is the same as the MEC Plus, where it has the simple copays through the PHCS network. However, there's also a value added benefit through MetLife that will pay a benefit to the employee for hospital admission of $1,500, intensive care admission, also $1,500, hospital confinement, it'll pay $300 per day up to 15 days, as well as a hospital ICU confinement, and it also includes newborn nursery confinement. Again, the MEC plans, similar to an association plan, participation and contribution, there is no requirement. We do go down to 1 employee on our voluntary program. And again, you set it up any way that you want. The plans and rates are the same in all 50 states. So again, doesn't matter how you set it up. We offer 3 plans. You set it up, and then we'll set it up for your employees. So you select the plans, and then we will set it up. We're also going to be offering a new voluntary MV plan option. It also is part of the MEC family. As you can see on the screen, the IHP Basic and the IHP Premier. The MV plans provides more comprehensive coverage, such as in and outpatient hospitalization. Services are also provided through the National PHCS network. The MV plans meet both penalty A and penalty B requirements, so you would be compliant for both. The one of the requirements is that the MEC plans has to be offered alongside with the IHP MV options. And SBMA requires a minimum participation of 25 enrolled. So this would be a good package to provide for the groups that have over 50 full-time equivalent employees. Again, same plans and rates in all 50 states. Some of the features: guaranteed issue, no medical questions, no pre-existing condition limitations, no waiting periods, inpatient and outpatient services, as well as emergency care, maternity, and prescription drugs are covered. I do want to make mention, you'll see where the asterisks are a few, the benefits such as the inpatient and outpatient surgery and some of the other services that are listed. After the copay, for instance, the $350 copay for the inpatient, benefits are subject to reference-based pricing. And what that means is the plans will pay up to 200% of what Medicare pays out. So there may be balance billing, but I do want to make mention that it will pay up to 200% of what Medicare pays out. Other benefits that we offer: voluntary dental plan option. We offer 3 plans, and again, this is voluntary. We offer 3 plans for PPO plans and 1 managed care plan in California. Our plans are through MetLife for the PPO, Delta Care for the California HMO plan. The PPO plans has a deductible of $50 individual, $150 for the family. Benefit maximum, plan 3 and 4 is $1,000, while plan 5 is a $2,000 max. The preventative services on all 3 plans are covered at 100%, basic 80%, Major services covered at 50%. Plan 3 does not cover orthodontia, while Plan 4 is the same as Plan 3, but it does cover orthodontia up to $1,000 lifetime. Plan 5 is the same as Plan 4, but the maximum benefit here is $2,000 instead of the $1,000. As you can see at the bottom, there's also a couple asterisks there. The out-of-network is reimbursed at the 90% percentile based on the reasonable customary of what the lowest charge of the most dentists in the geographical area that you're in. And the reason I have that with the asterisk is for those of you that are on the current dental program, we had a few questions that come in on balance bill. So what we did is MetLife has offered to increase the out-of-network benefit, whereas it was increased to a 90%, which means that 9 out of 10 dental providers should accept the MetLife benefit without any balance bill. Doesn't mean there won't be a balance bill, but we've increased it so that it's less likely for you to have a out-of-network balance bill. For those of you in California, we also offer you a HMO plan through Delta Care. Simple copays, no deductibles, no annual maximums. You just pay a simple copay as what you can see on the screen. Now, these are only examples. The guide that we have, plan summary from Delta Care, is 23 pages long, which includes codes for all types of services. So again, this is only a example of some of the copays that you may have with Delta Care. Voluntary vision, we offer 2 plans. Both are through VSP. Plan 1224, there's a $10 copay once every 12 months. Glasses, lens frames, $25 copay once every 2 years. Contact lens instead of glasses, $25 copay once every 2 years. Plan 1212, the only difference from Plan 1212 to 1224 is the glasses or contacts is a $25 copay once every 12 months. So not much of a difference other than the copay once every 12 months or every 24 months. Frame allowance on the 1224 is $130, while Plan 1212 is $150. The contact fitting evaluation copay, both same for both plans. Retinal imaging, the same for both plans, as well as the laser vision correction of the 15% discount. Retail chain providers, we've added Sam's Club for 2023. Costco and VisionWorks are also covered. So again, retail chain providers, Costco, VisionWorks, and Sam's Club for 2023. Life insurance option, employer pay is going to remain the same at $10,000, where the employer would pay the cost on it. It is through MetLife. Voluntary life is also through MetLife. Benefit will remain the same. It is employee pay 100%. Maximum you can select as the employee of 150,000, increments of 10,000. Employees can select for spouse up to 50,000, and dependent children maximum of 10,000. So it would be one cost for, doesn't matter how many dependent children. Evidence of insurability is not required when an employee is first eligible. If an employee is looking to enroll in life insurance, let's say at open enrollment, the 2nd or 3rd year, they will be required to complete a health questionnaire. So again, employees, if they want to get on, best time to get on is at the open enrollment when they're first eligible. Voluntary telemedicine. Although under the comprehensive and the MEC plans, the telemedicine is included. But if you have employees that decide not to enroll in the voluntary or the comprehensive medical, they can select the telemedicine on their own, which is through Teledoc. Basically, if you have an employee that is on their job and they're not able to visit their primary care physician, they can call in to the Teledoc by phone, video, or app. They would provide the doctor with a summary or their symptoms, and the doctor will provide them with a diagnosis, and they'll even call in a prescription. Some of the medical conditions that are called in: cold and flu symptoms, allergies, bronchitis, sinus problems, ear infection, and more. I know my son had something in his eye. He took a picture, uploaded to his app, and the doctor looked at it and called in a prescription for him. So I know it personally, it's a good program. Voluntary hospital confinement. This is the program that most employers will package with one of the voluntary MEC plans. We offer two plans, a high plan and the highest plan through MetLife. Benefits cover both injuries and sickness. Benefits paid for inpatient, outpatient medical treatment received in a hospital, emergency room, or the doctor's office. One of the increases that we've seen for 2023 is the daily hospital confinement, where depending on the plan, the confinement pays $200 a day, maximum $365 for the year. So it'll pay for the full year. Other additions for this plan: pregnancy has been added, as well as lodging. Some of the benefits have been increased for 2023, but you'll want to take a look at the benefits on your own. So again, additional benefits include surgery, anesthesia, diagnostic exams, pregnancy, and lodging. Voluntary accident. The plan covers accidental injuries regardless of any other insurance. The plan, again, through MetLife. Benefits cover both inpatient and outpatient treatment. Services cover more than 50 benefits: hospital admission, hospital confinement, ambulance, emergency treatment. So the hospital benefits and the treatment benefits that are listed are services or treatment that is provided when you visit the hospital or the doctor's office. The plan will also pay lump sum for any fracture or dislocation. And there's a few examples. Again, there's several pages of the lump sum payments for the fracture and dislocation. So for instance, if you happen to fracture your skull in an accident, it'll pay a lump sum up to $5,000. Dislocation, if you happen to dislocate your collarbone in an accident, it'll pay up to $1,500. But again, these are only a few examples. We have several pages of lump sum payments. So what are some of the most popular solutions to help you hire and retain employees? So we've got packages listed, and these are packages that we find that a lot of employers will select one of the packages to offer their employees. Package one, the employer offers a dual MEC plan and contributes towards the employee-only costs. The employee contributes the balance of the employee cost plus dependent cost and any buy-up plan. Then the employer offers a voluntary benefits at 100% employee pay. So basically the voluntary medical, the employer would contribute, the employee would also contribute to it, and plus any dependent or buy-up plan. All the voluntary benefits, other than the medical, would be employee pay at 100%. That would include dental, vision, life, telemedicine, accident, and the hospital confinement plan. As you can see, the hospital confinement is in bold because this is where most employers will include the hospital confinement packaged with the MEC plan. Package 2, employer enrolls in a management-only group health plan through the special enrollment period. Employer would contribute, obviously, 100% for themselves. 50%, let's say, for one of the doctors or the management employee. Then the employer offers voluntary benefits to the non-management employees at 100% employee pay, which include the MEC, hospital confinement, dental, vision, voluntary life, telemedicine, and the accident plan. I know there's a few of our current clients right now that have taken advantage of the special enrollment period, but I'll get into that again in a minute or two. Package 3, employer enrolls in a comprehensive group health plan. Employer offers a dual medical option and contributes 50% of the employee cost of the lowest plan. Then the employee contributes the balance of the employee cost plus dependent cost and any buy-up. The employer offers the voluntary benefits at 100% employee. Now, again, under the package 3, enrolling in a comprehensive plan, most employers will contribute for, let's say, the bronze plan, whereas the employee would contribute 50% of the employee, and then the employer would, let's say, offer a silver or a bronze plan, and employee would have the option of upgrading. And then package 4, which seems to be a more prevalent plan where employers are offering the voluntary benefits to all employees at 100% employee pay. The employer does not contribute at all. And then this is where the employee would offer all our voluntary plans at 100% employee pay. Cost breakdown. Thought I'd give a few examples of cost breakdown to give you an idea how the plans are set up. So step 1, the employer sets up a class of employees based on the job title. Now, I know there are different job titles for the different brands. So what I've done is I put class 1 as the ownership, class 2 management, and class 3 non-management. And again, based on your brand and the type of employees that you have, you decide how you want to set up the class of employees. Step 2 would be then the employer sets up a comprehensive group health plan for ownership and the management level employees. Employer contributes 100% for ownership and 50% for management employee. Step 3, the employer sets up the voluntary medical plan for non-management employees at 100% employee pay. And again, we can help you set it up. You decide once we talk with you on how you're thinking of based on your class of employees. And then step 4, employer offers additional voluntary benefits to all employees at 100% employee pay. And that it would include the hospital confinement, dental, vision, voluntary life, telemedicine, and accident plans. Now, on the monthly cost, now again, this is only an example. Let's say the owner, age 55, decides he wants to go with our United Healthcare PPO plan. The plan includes a $2,000 deductible, 80/20 coinsurance, $40 primary care physician copay, $50 urgent care, and $15 prescription drug card. Monthly cost for that employer, for himself, $885. He would contribute 100% of the cost. Management employee, let's say age 47. Employer also offers the United Healthcare PPO plan, but he also offers a $5,000 deductible, same coinsurance, primary care physician, copay, as well as the urgent care and prescription drug card. Monthly cost for this 47-year-old management employee is $657. The employer says, I will contribute 50%. As you can see, the split in the cost. Non-management employee, age 35, the MEC Plus plan through SBMA, $15 primary care physician, copay, urgent care, $50, $15 prescription drug card. Monthly cost, and again, this is only an example, $118. The employee would contribute the full cost, whereas the employer does not contribute. So switching gears to the Affordable Care Act. Some of the key provisions of the Affordable Care Act. The individual mandate no longer exists. In most states, individuals will not be penalized for not having health insurance. The employer mandate, however, remains in place for now. Congressional efforts to repeal and replace the ACA have installed, and I think with the way the political what the political logjam looks like right now, I don't anticipate any changes. So let's take a look at a few key provisions of the ACA and how it will affect you. A full-time employee is an employee that works at least 30 hours. We get calls every day where employers consider their employees that work 40 hours or more a full-time employee. However, under the ACA, an employee, a full-time employee, is an employee that works at least 30 hours. Benefit waiting periods must be 90 days or less. I will say most calls we receive, employers will have a 6-month waiting period. However, again, benefit waiting periods must be 90 days or less under the ACA. How we set that up is you can have a 60-day waiting period. So what we would do is we would have it as first of the month following 60 days. So the max could be 90 days or less. Employers with less than 50 full-time equivalent employees are not penalized for not providing health insurance. So if you have less than 50 employees, you do not have to offer health insurance and you will not be penalized. For those employers with 50 or more full-time equivalent employees must provide health insurance or pay a penalty. So let's say you've got 75 employees, and just for argument's sake, and you've got, let's say 25 employees are full-time, the other, or let's go with 30, the other employees maybe you have 30 full-time and or the 30 part-time. Generally what we look at is 2 for 1. So we would add another 15 employees. So let's say you have around 40 full-time equivalents. You do not have to provide health insurance and you will not have a penalty. But again, for those of you that have over 50 full-time equivalents or over 50 full-time employees, you may want to reach out to us. And we do have a colleague that works with us that he works strictly through for ACA compliance. I know there's a few clients that are on the webinar today that use the services of Trusaic. They will work with you on identify if you are a large employer. They will, some of the services they offer, testing, applicable larger employer testing. They'll look at the methods set up, look back or your monthly. I think most of you that are current clients are on the look back monthly performance, and they will reach out to you and let you know if some of the employees need to be offered benefits. They'll help you with the IRS. If the IRS comes to you, and has a audit. They will represent you. They will also help us in working with you on setting up the benefits program. Some of the challenges that they have found in working with franchisees that have over 50 employees. TRISAC understands the insurance products and plan designs and how it affects on the ACA. They will determine the full-time employees in an industry where the employees are in, out, and in again. Variable hours, I know, happen to be a big concern. Documentation to demystify compliance to a workforce that is in the field and unresponsive. Cost of the MVP programs and meeting carrier participation guidelines, often 50% or more. So for those of you that are in that have over 50 employees, we're able to enroll you during the special enrollment period, which again, I'm going to get into a minute. And this is where most of the clients we have right now that have over employees have enrolled during this special enrollment period. And another challenge is how the ACA applies to your own specific facts and circumstances and options to help solve the based on your business driver and how it affects you on hiring and retaining employees. So looking ahead to 2023, the group special enrollment period, which I've been mentioning, is a 30-day window from November 15th through December 15th. It's a little known requirement under the Affordable Care Act, which requires health insurance insurers to offer a 1-month special enrollment period, again, November 15th through December 15th, to employers in a small group market who do not meet the employee minimum participation or employer minimum contribution requirement. Many insurance brokers do not know about this requirement, and insurance carriers do not want you to know about this because there's no spread, there's no risk spread in offering the benefit. Under normal underwriting, insurance carriers require 50% of eligible employees to enroll. Under the special enrollment period, 2 full-time employees must enroll. You're probably thinking, you and your spouse, 2 employees on the payroll, you have a group. Under the Affordable Care Act, husband and wife are considered as 1 employee. So under a healthcare reform, if you offer coverage to 1, you must offer to all. So how do we get around this? And I did mention before about setting up a class. So for instance, class 1 would be ownership, class 2, management, class 3, non-management. So whatever you offer in that class to 1 employee, you have to offer the same to all employees in that class. So let's say class 2, you have 4 or 5 management employees. What you offer 1, you have to offer to all. Same with the non-management employees. You can have as many classes as you want. You decide, we'll help you work on that. But again, this is probably the busiest time of the year for us is the special group enrollment period. So if you have, let's say 10, 20 or over 50 employees, and you only can afford, let's say for having a management only plan, this is the time to enroll, get a hold of us. We'll need to obtain some information from you, and we'll provide you with a proposal on the cost, and then we'll help you set up the program. So what does our benefits enrollment platform look like? We offer 4 steps from step 1 through step 4. Step 1 is a discovery. The first step is to identify your objectives of offering benefits that reflect both you and your employees' needs and budget. We will gather group information, discuss your goals, benefit options, and your budget. once we obtain the information, the census information, we will send it out for carrier quoting. Once we receive the quote back, we will present it to you at that time, and then we will review it with you, allow you time to decide on how you want to move forward. And then once we review your thoughts, we'll work with you on formulating a benefits plan, which will lead through step 3. So once you've decided you want to move ahead with offering benefits, we will put together a guide for you, an employee enrollment guide that you could share with your employees. Well, depending on the timing and the number of employees, we may conduct a benefits webinar for your employees. In the meantime, we would send you a DocuSign employer application and begin the build out of an online enrollment platform, which would lead to step 4. The online enrollment platform will help you spend less time collecting and reviewing paper forms and communicating benefit details. For the employees, they can select the benefit options that best suited to their specific needs. How our online enrollment platform works: at the time of orientation, you would send employee login emails. The employee would create their password and complete their registration. Once they're logged in, they would verify their personal information, add any dependent information, and then they would begin the step-by-step enrollment process. For each benefit, they would choose the coverage level. For, let's say, the medical, they would choose the plan, their dependent level that they want to select. They would go through the process. Once they are done, they would need to go through each benefit to select if they're going to enroll or waive. Once they're done, they would review their benefit summary. And then once they've done that, they would e-sign their enrollment form. If they do not get at the end allowed to e-sign, that means there was part of the process they did not complete. They will need to go back into it to complete it. Again, the enrollment is not processed until it is e-signed. And the reason I'm bringing that up is if they go through it and they do not e-sign, then we do not know that they have completed their enrollment process, and it would not be provided to the insurance carrier, because we have several of the carriers that it will be automatic synchronized with the carrier and will be automatically processed through the carrier. So again, employees will need to make sure they complete the full process of enrolling and e-signing their enrollment form. At this time, we'll open it up for questions and comments. Michael, if you want to take some of the questions, and I'll be happy to answer them.
Okay, so at this time, if you do have any questions, please feel free to click on the Q&A button. And as we said, we will get to them in the order that we are receiving them. The first question is, for ACA plans, can 2 employees include one owner and the owner's spouse?
Did it say how many employees they have?
Did not.
Okay, so under the ACA program, we do need to have, now this is the comprehensive. We do need to have 2 employees because a group plan is 2 employees. A husband and wife is considered as 1 employee. However, we have enrolled husband and wife that have different last names. If you have that, then yes, we can do that. However, under the comprehensive ACA, husband and wife is considered as 1. Our voluntary medical plans, we go down to 1. So if it's only the husband and wife that want to enroll, that is good for us. So you can enroll husband and wife under the voluntary medical plan, which is also ACA compliant. But the comprehensive, we do need 2 employees. husband and wife considered as one, we do need another active W-2 employee. So hopefully I answered your question.
Next question is, are these plans incorporated into my payroll so my employees can take advantage of pre-tax payments for healthcare costs?
Yes, definitely. Plans are can be set up pre-tax, where the deductions, contributions are taken before taxes. So yes, we can, I would say that almost every group that we work with will set the plans up payroll deduction.
Okay. On the dental plans, is there a waiting period before you can use them, or can they be used right away?
Good question. Our current plan has no waiting periods, as well as our dental plan through MetLife. Again, a major increase, a major advantage for our dental plan for 2023 through MetLife. No waiting periods at all. So basically, if somebody enrolls for, let's say, December 1st, they begin, they can go to the dentist with no waiting periods. And we're basically talking for, let's say, basic or major services. So good question.
The next question is, if someone picks MEC Advantage and hospital confinement, is it fairly equivalent to a bronze plan on the exchange?
Now, that's a good open-ended question, because the bronze plan on the exchange generally have high deductibles, which means generally the plan will have a $65 office visit and probably anywhere from a $7,000 to a $10,000 deductible. Our MEC Advantage plan has copays, which from $1. So it's really hard to compare both plans, because the MEC Advantage is ACA compliant. So if you're in a state that requires individual health care, the MEC Advantage would qualify in place of the exchange plan. The exchange plan does have subsidies that may lower the cost of the bronze plan, whereas the MEC Advantage, we have set cost on it. So I think the best thing to do is probably get a hold of us, and we can work with you on looking at both sides of it and give the best suggestion. But again, the MEC Plus just has simple copays from day one, whereas most bronze marketplace plans have high deductibles and high copays. So, I mean, we are talking night and day, but we have quite a few that the employer will go with the MEC plan simply because of the high cost or the high deductible plans for the marketplace. So go ahead if there's other questions, Michael.
Next question is, does package 3, going back to those packages that you showcased, require a minimum number of employees or plan participants?
Package 3 is where the employer would select can select two plans, comprehensive medical plans. And if you enroll during the special enrollment period, then there is no minimum required of employees to participate. However, if you enroll, let's say during the year, and it's not through this window, this 30-day window, then yes, there is a minimum number of employees that have to enroll. Generally, it's going to be 50% of the eligible number of employees. So if you have 20 employees and the minimum number of eligible is 10, then you will have to have 50% of that 10. So there will be number required if it's not through the special enrollment period.
Next question is, the group plans available in all states?
I'm sorry, is the group plan available in all 50 states?
Yes.
Correct, yes. The group plan is available in all 50 states, and we're talking the comprehensive plan as well as the MEC plans are available in all 50 states.
Next question is, our payroll vendor as well does ACA compliance. What makes the company you spoke of, Trusaic, any different?
The biggest difference between the two is that Trusaic individually will review the ACA and work with you. Vendors such as, let's say, ADP, they will provide you with software, and you will be required to work the ACA, whereas Trusaic will actually manually look at your employees, your list of employees, and if you offer benefits or not, and they will let you know, whereas the software, it's you providing it yourself.
Next question is, if you want to offer the plan after 6 months of employment, how can you avoid the issue tied to pre-existing conditions?
If you want to offer the plan after 6 months of employment, we don't have any pre-existing conditions on any of our programs. So really what we're looking here, first of all, is if you want to offer the plan after 6 months of employment, you're really not applying to the ACA because the max is 90 days and you mentioned 6 months of employment. So that doesn't really fall under the ACA requirement. But again, all our plans do not have any waiting periods, including the ACA compliant plans, the comprehensive plans. There is no waiting period. So to answer your question, there are no waiting periods.
This one was somewhat answered, but can you offer plans that are accepted by the different states franchisees represent?
Can you offer plans? I'm sorry, can you read that one again?
Can you offer plans that are accepted by the different states franchisees represent?
Yes. Now, again, the comprehensive plans are going to be based on the state that you're in. Now, if you have employees that are in different states, I'm not sure if that's what they're asking, but if you have employees in different states, the plans are going to be based out of where the corporate office is located. Now, this is for the ACA, for the comprehensive program. When it comes to the voluntary program, it's going to be the same plan in all 50 states, same rates in all 50 states. So for the comprehensive, it's going to be based out of where the corporate office is. For the voluntary, it doesn't matter what state you're in, it's the same plan, same rates.
Next question is, where can you look up the average costs? For example, the cost of hospital stays, certain procedures, etc.
Depending on what state you're in, you could actually reach out to the, let's say, the hospital or the doctor's office that you're in. Again, depending on the carrier, for instance, we utilize United Healthcare as our main carrier. You would be able to look at the costs that United Healthcare has put a report out. And again, that's probably something that you can reach out to us to provide you with information on.
Okay, that is all of the questions that we have.
Okay, I do want to mention here that you could see our contact information. Again, we will be sending out the recorded webinar along with the employer guide and information on the special enrollment period. The site that's actually listed on here should be the Best Life Brands website. If you have any questions, please give me a call. My phone number and email is here. And again, we will get the information out to you. If you have any questions, again, please reach out. Megan, if you have any closing comments, go ahead.
Sure. Well, just thank you everybody for attending. Thank you for staying with us a little bit longer than planned. We're glad that you were able to join to learn more about Franchise Benefit Solutions and what they have to offer. Again, just a friendly reminder to complete that survey that we have out there so that we have some ideas from you on what to plan for 2023. And thank you, Bernard and Michael, for taking the time to host this webinar. And everyone, there will be a recording of the webinar available soon. So keep an eye out for that in case you want to rewatch it.
Again, thank you, Megan and Michaela. Thanks again for allowing us to partner with the brand Best Life brands. And thanks everyone for joining, and have a good weekend and the rest of your day.
And a happy Thanksgiving.
That too.